I'm here today with Dr. Marco Gutierrez, who's an associate dentist in the Shoreview Clinic. He's been involved with our caries management program for over 3 years now, and so we'd like to hear his comments about our program. Thank you, Marco. So Marco, could you tell us a little bit about your first experiences when you came to this practice and saw that we were using medicine to treat caries rather than drills and needles?
I was skeptical. I wanted to see it before I believe it, and through the years I tried it, and it works. It's just amazing that something, this small amount that you can just apply to the tooth, and the caries is arrested. I never seen this something like this before, and I'm sold for sure.
So how many cases do you think you've treated?
Thousands. It's just 3 years, and we see a lot of patients. It's nice to be able to address the infection of this disease that nobody has been able to address appropriately. I believe that restoration is just not the result. It's not the answer. We need to address the infection first before we deal with the effects of the infection. And this medication does it. It's just a miracle come true.
Great. Well, it sounds like it's made your life a lot easier as a practitioner. And how have your patients responded to this form of treatment?
Well, I've been thinking of how this approach has affected my clinical aspects of treating patients. And for me, treating a patient is giving them the best experience that they can have. And I kind of compare myself to the movie Patch Adams. And if I can give a good experience to a patient, I'd do anything. And this medication has been able to help me provide that service for them, and to get them to the point that they're nervous and anxious to be joking around with me, and I'm just speechless.
Well, thank you. It seems to me that this process for managing caries is scientifically and medically sound. It's based on the biology of the disease, elimination of the infection prior to restorations. It seems to me to be well accepted by patients because we're able to atraumatically stop the infection and, if necessary, place restorations atraumatically as well.
Yeah, I'll say 90% of the time I don't even have to use an injection. Again, that's something that I can provide better experience to patients. I don't think myself I like injections, so therefore I'm pretty sure that my patients don't like it either. And to be able to do a restoration, I mean, big restorations that when I first started, is like, there's no way I can do a restoration this big without an injection. And I have done it many times.
How close to the pulp can you get in terms of arresting caries in your patients?
Actually, I was looking at a chart this morning, and there was one, if you would open it, it got into the nerve. And I put the medication, put a temporary filling, and it's been a little over a year, and patients asymptomatic. Filling is doing good, patient's doing good, tooth's doing good. You can see a secondary dent forming. Therefore, it has worked. We just go back and fill it, and that's it.
So if we get rid of the infection, it gives the tooth time and the nerve time to heal itself, basically.
Yeah, somebody told me sometimes we get involved with it too early, that we don't let the body heal itself. And with this medication, we are able to provide some time for the body to let it take care of it itself.
Do you think that other dentists are going to be able to quickly learn and embrace this approach to care?
Well, first of all, you have to be open-minded. I'm not sure I was going to accept it myself, but you have to try it in order to see the effects, like anything else. But as long as you're open-minded, you're going to see the effects of it, and you're going to like it.
What's amazing is that the literature supporting using silver ion as an antimicrobial agent is more than 100 years old and well established in the dental literature. And by adding a relatively new fluoride to our protocol, we are able to come up with a combination that is extremely effective.
Very, very effective.
Any parting comments you want to share with our colleagues before we finish up today?
It's just start enjoying dentistry, because this is the miracle of dentistry.
Thank you, Marco.
Thank you.
All right.